Like wiggle it.
Ah.
There we go.
Wow.
Solid. Good. There we go. Disc. White is bone, 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 bone. And you can see it right here.
C5 and C6. Yeah.
C5, C6. So this is 2, 3, 4, 5, like right in here. Well, this is for YouTube. So basically what we're doing today is we're doing a little bit different today. I wanted to document the exam. I wanted to document the treatment and then find out your reaction. So she reached out to me because she has a C5, C6, C6, C7 disc herniation that is affecting your bicep and your deltoid. And you can see she's wearing lidocaine patches on her arm. And this matches the dermatomes of what's going on. So we have an MRI here, and right here, there's a little bit of pressure being placed in your spinal cord. And I pulled up on the program exactly where that's going. So if you have a C5, C6 pressure, you should feel that. This is 7, right exactly down the arm into the thumb. And you're feeling it deltoid.
Right here too. Is this a deltoid?
That's deltoid. So we're going to do part of our exam just to document everything. So have a seat right here. So I want people to understand what's going on before we do any manipulation. Just sit in. Okay, cool. So just look straight ahead. So let's just do this. Arms up. So a little hitch on that side, right?
Yeah.
Okay, put it down. So I'm going to do some muscle testing, all right? So we'll do the bicep first. Pull, don't let me out. Strong. Okay, good. Weak.
Really weak.
Can you pick that up on camera? Yes, you can. Really weak on that side.
It's really weak.
So I'm going to put your arm up like this. And what I'm going to do is I'm going to push down, resist, okay? Strong. Bring the side up. Yeah, not that bad.
Not that bad.
Okay, put this arm down. I'm going to do this side. Down, I'm going to pull out. Don't let me.
Okay.
That's strong. Pull out. Don't let me. Not bad.
I'm better than I was.
Okay, arms up. I'm going to push down. Don't let me. Strong. Don't let me push down. A little weak there.
Yeah.
Okay, put it down. So we did this side was strong. Bicep, good. A little weak there. So I'm going to do tricep now on this side. So don't push down. That's strong. Same thing, push down. Not terrible.
Yeah.
So I'm going to check reflexes now. Right here. Relax this. Look straight ahead. Good. Good reflex. Over this side. No, relax this.
Feels like nothing.
Yeah,
oh, because
right?
it's going on your hand.
Yeah, relax this. I'm sorry. Kind of diminished reflex on this side. Okay, so you're losing some muscle tone for sure.
Yeah.
Weakness, how's sleeping?
I don't really sleep much.
So I'm going to push straight down. If it causes pain, let me know. I'm not looking to make things worse here.
Okay.
How about when I do that?
No.
Okay. Bend your head this way, and I'm going to push straight down.
No.
Okay, come this way.
No.
And that was no with a hesitation, maybe a little bit.
Well, I think it was, it was just an interesting position.
Yeah. Like that, or like that.
No.
Okay, good.
Nice.
Chin down. Occiput. Let's see, 1, right in here, 2, 3, 4. Here. Okay, let me see your range of motion. Turn this way. Turn. Okay, now come this way. A little diminished to the right. Notice that? A little harder.
I can't go more than that.
Okay, bring this ear to the shoulder. Okay, come this way now.
My doctor was saying that my right shoulder is starting to compensate, like it goes up for me when I'm trying to do anything, like it starts to shift.
Misalignment and the nerve irritation is definitely still there, so we want to address that today. Let me see what you're like in extension. This is bringing your head back into extension. Does that cause a pinch at all?
A little bit, yeah.
A little bit where?
Sort of where your hand is right
Right
now.
here.
No, the fingers, they were like down. It was
Okay, right in here. Okay. How about going into flexion?
It's getting better.
Okay.
Yeah, but before I would say, like when I look down, it would shoot pain there,
Right.
but maybe it's...
So that's the brachial plexus, which is the nerve that go down into your arm. So you're looking at this, that. There's definitely some pressure here for sure.
Yeah.
All right, so the next thing I'm going to do is I'm going to have you laying face down on this table.
Okay.
All right, take your glasses off. So a little bit of background, professional dancer here in Manhattan, so movement is such an important part of her life, yes?
Yeah.
And we want to continue to move, so having your spine properly aligned and having those nerves not irritated is super important. Put those arms down in front of you, there's an armrest, and down. Okay, good. All right. Up in here. And your background is not having any chiropractic care previously, or you've had care?
No, I'm kind of scared of it.
So we're...
But I know.
Yeah, you're in good hands. So we have a lot of time people have a fear of chiropractic because they've seen all the videos, but you know, it's when we get in there and remove that interference, your body's work so much better. So what I'm feeling for is I'm feeling for muscle tension, and there's a lot more muscle tension up in here in the right side than there is on the left side.
Right.
So one of the things that, you know, I excel at is not just addressing the misalignment, but also soft tissue component or the myofascial component. So more than likely, you'll get adjusted today, but we're also going to do some soft tissue work.
Great.
Okay, yeah, all in here. All right, I'm going to go back to the leg check. I'm going to come over here. You stay right there, you're good. Short on the left. Turn your head to the left, just your head. Okay? Turn your head to the right. There we go, balances out, back in the middle. So there's definitely something going on in the cervical spine, misalignment-wise, right there. So C5, C6, sit up straight. Okay, so we determined through, you can leave your glasses right there, through an examination and MRI findings that she's got C5, C6, disc herniation that's causing nerve pressure into the bicep. We have a diminished reflex, so she's doing medical treatment, but I think to get her moving and feeling better, we're gonna do manual spinal decompression using the ring dinger technique. So let's have you lay flat on your back. Okay, gotcha. Slide up a little bit more, not maybe too much, come down to right there. And I'll talk you through everything. You know, this is, you know, first time ring dingers is a bit much, but it's gonna take a lot of pressure off your spine. Breathe in, and let it out. There we go. So you have it right above your hips.
Okay.
So what's gonna happen, hands on your stomach, your teeth are gonna be together. You're gonna keep your tongue in your mouth, you're gonna breathe in and out through the nose, and I'll talk you through it. So what you should feel is that you should feel a release in the neck. It might even go all the way down to the lower spine.
And you're sure this is in the right position?
You are right there, you're locked in, you're good to go. Pick your head
Okay.
up for me, put it down, good, rest your head down. Good, I'll talk you through it, just relax and breathe. Okay, good. All right, good. So what we're doing is we're taking pressure off the spine. Breathe in, and let your air all the way out. Good, breathe in again. And let your air out. And wiggle your left big toe, like wiggle it.
Ah,
Stay right there.
Okay, not.
That was it.
Okay,
Okay, where'd you feel that release?
down at the bottom.
Okay. Good. Now we're gonna get that cervical spine. Breathe in. And 2, relax his head down. Don't help me, relax this, down, drop. There we go, good. That wasn't too terrible.
Yeah.
Breathe in again. And relax your head, let your air out, drop this, wiggle the toes. There we go.
Ooh, wow.
Are you okay with that?
Yes, sir.
Did that hurt?
No, sir.
No. Okay, relax this, let's take a look. And reflexes still in, so you're still kicking. I'm gonna take you out.
And so is my lower back supposed to practice?
It's supposed to move, yeah. Usually when I do this, it goes all the way down the spine.
Wow. Oh, but I'm just stuck.
You're stuck. Turn on your side, facing me, and push yourself up to a seated position. And stand up. And what's different with the neck now, if anything?
Range of motion. I mean, I hear some cricks right now.
Range of motion is a little bit better?
Yeah, range of motion, absolutely.
Okay, good. Let's do the rest of your spine now.
Yeah, I can move my head more.
Okay, so we're gonna do the rest of your spine. You ready? Let's go face down. All right. So a lot of move down towards your feet a little bit, like shimmy down. There you go. Okay, so up in here, this upper T1, T2 region, really restricted. Relax these shoulders for me. Good. Okay. I'm not gonna force this, but I want to get this to move. So take a deep breath in. Relax this. Don't help. Stretch. Stretch. Let your air out. Good. There we go. All right. Not terrible. Okay, breathe in again. And let your air all the way out. Bend your knees. Unshrug. There we go.
Wow.
Wow. That was really big. Did that hurt at all?
No.
That was pretty awesome. Okay, so I'm gonna get the rest of your spine here. Good. And when we treat people, we treat them as a whole spine. We don't just treat them as a C5, C6, because the whole spine works together. You've been moving your whole life, right? So we treat you from top to bottom. Good. Good. Breathe in again. And drop this. Drop, drop. Solid. Okay, flip over. You hear lots of oohs.
Yeah.
And good. All right, nice. Drop this. There we go. Good. All right. Let me see this arm, and just kind of like Jesus, arms out. Okay, good. All right, good. Bring it back to middle, and then sit up straight. Okay, cool. How are you feeling after that?
I'm feeling great. Yeah. I mean, I would say that.
Are you getting this? Okay.
Yeah. I mean, I have more range of motion. I'm hearing stuff in my neck now, like little
Clicks
clicks and bubbles.
and pops. That's okay.
Yeah.
Okay, so now what I want to do is the soft tissue component. So have you seen this stuff before?
No.
Okay, so this is, it's called a Grassland technique. It's a stainless steel instrument. And what I'm going to do is I'm going to be working on that right trap, breaking up the myofascial component. You've heard of fascia before, yes?
No.
So fascia is the connective tissue that holds all your tissues together. So you're just going to sit here, facing the camera. So, you know, I think this is often overlooked. A lot of chiropractors don't address the soft tissue. So I'm not going to talk for a second. I'm just going to listen.
Okay.
Okay, what I love about this technique is right there. Feel those.
Yeah.
Okay, and right there too. Rhomboid. Take your right hand, put it on your left shoulder, and bring your chin and look down and away. Yeah, there we go. Right there. Okay, this you can pick up on camera. Look at this. So and I'm using a lot of weight. If I was using a lot of weight, I'd be using two hands. I'm just kind of gliding. So all those little red dots, they call petechiae, they're breaking of blood vessels. So this is gonna go down in a couple hours, but this means that this rhomboid muscle needs some blood to it.
So I got a date after this. Am I bleeding?
They're gonna call you look like a hickey.
Oh, really?
Yeah.
Okay.
Okay, relax that arm down, and let's see what your range of motion looks like now.
Good. Yeah, it feels really good.
Feels better.
Yeah, I mean, I feel like I could teach a class right now.
So that, you know, typically you'll see stuff like that is, you know, chiropractic gets you moving quicker than physical therapy, gets you out of pain quicker than other things, and you know, you're doing the right thing by doing multiple modalities, but you know, what you're feeling is nerve compression, and that's why we did the ring dinger to take pressure off the spinal nerves and the discs, and we did a full spine chiropractic adjustment. So let's see, I want to do one more thing with you. I found this right shoulder. This seems a little anterior, so we're going to bring it back posterior. So let's see if we can get this to go easily. Okay, relax this. Breathe in and let it out. Okay, good.
Oof.
All right, good. Stand up. So what percentage different do you feel?
I would say, like, I can't tell, like maybe 80%?
Oh my God, don't tell me, tell 80%.
80%?
80% is pretty big.
I think so, yeah. I mean, the noises in my neck, is that like...
That's okay, yeah, because we just moved a lot of stuff.
We moved a lot,
This is visit number one.
Yeah.
You're probably gonna have to do this a couple times. You know, the difference that with me is I'm not gonna see patients for 36 visits. I'll see people 6, 8 times, release them from care. If I can't get you 100% in 6 visits, 8 visits, the way you feel, you know.
Surgery.
Well, no, surgery is a last resort.
Yeah.
Surgery should be last resort. You should not even, you should get surgery out of your
No,
head.
I hurt so bad that I was like, just do it.
Well, no, surgery is last resort. Chiropractic, acupuncture. How is that area feeling now?
Pretty good. Yeah, it was really sore to the touch, but now.
So so we'll go back to here. So I just want to point out, and I'll give you your MRI, your disc back. See, I saw some of those videos.
Yeah.
Crazy movements, you
A
know.
lot of necks.
A lot of neckography, like, you know, a lot of this. So it's going to put pressure. So you have to make sure everything is dialed in and aligned. Moving for 30 plus years, it puts a lot of pressure, and that's why generally athletes have chiropractors in their locker room. NFL, golf, chiropractors are part of their team because it wants to extend their career. So when you're 20, you're indestructible, right? When you're a little older, you need somebody on your side to keep you aligned, balanced, and dialed in. That's what chiropractors do. So the vertebrae, remember this is the vertebrae, this is the disc, this is the nerve. Puts pressure.
Is this really me, or this is an
No,
example?
this is an example.
It's not mine, okay.
Not yours.
This is an ideal neck.
This is an ideal neck. You're looking
Okay.
at a curve. So what you have here is you have a disc that's putting pressure on the nerve, and wherever that nerve goes, is going to go down the arm. It's going to cause weakness, numbness, burning, and you want to address the root cause of the problem, not the symptoms. Generally, when you're in pain, epidural or pain meds will address symptoms. That get the symptoms down a little bit. That's fine. Now we have to work on addressing the root cause of the problem. That's where the chiropractic care and the ring dinger and the myofascial work come in. That's what we do.
Got it. Wow. Thank you so much.
You're welcome.
Yeah.
Cool. All right, we'll see you in the next video.